In our first story, the Dade-Kotopon municipality consistently records the lowest coverage in immunization as many mothers fail to take their children through the complete course. With the help of a civil society organization, Concerned Health Education Project, the Municipal Health Service hopes to achieve at least 90% coverage to ensure that every child within the municipality is fully immunized this year. A report by Sarah Ofori.
Children within the ages of 0 to 5 years undergo routine immunization of the following vaccines: Bacillus calmette-guerin, also known as BCG, given at birth, oral polio, rotavirus, penta, measles, yellow fever, and pneumococcal virus, as well as vitamin A. These are administered on scheduled dates after birth. The vaccines are supposed to boost the child's immunity against killer diseases in the future. Since 2013, the Dade-Kotopon municipality has recorded the lowest turnout during nationwide immunization exercises. When the news crew visited the township and spoke to this 31-year-old mother of one, the evidence was contrary. She has never missed any of her scheduled dates.
Every month mommy date I made me copy pepe. Me deni ko musi na ho di muye. Sometimes obuti mi kase waba from to me na me mani emba ni normal.
Provisional figures available at the Municipal Health Service indicate that turnout was 54% in 2013 and 70% last year. Reasons for the gap remain unknown.
Most people in the community feel if the child is not is fine, there is no need to bring the child for immunization. Till the child gets 1 year, we have to give about nine different shots of the vaccine. We give BCG, then at point 0 at birth, polio 0 at birth. Then at 6 weeks, the mother has to come back. Then at 10 weeks, the mother has to come back. At 14 weeks, the mother has to come back. At 6 months, the mother has to come back. At 9 months, the mother has to come back. At 1 year, she has to come back. At 18 months, she has to come back. And she has to continue coming every 3 months till the child is 5 years.
Concerned Health Education Projects, who are specialized in community mobilization and health education, will, in partnership with the Assembly, engage the community to get every child immunized. With funding from the Global Alliance for Vaccines and Immunization, Gavi, the projects will track defaulters and ensure that they resume immunization.
In each electoral area, we are supposed to identify a satellite point. We are going to recruit 100 volunteers, and the intention is that each 10 districts will have 10 volunteers, against the backdrop that you are going to work with the health system.
Driven by the theme to get every child immunized now, the project will also create equal access to new and underutilized vaccines. The Municipal Assembly has pledged its unflinching support towards attaining such a goal. This suggests that the indigents must get involved, as this elicits a sense of belonging towards the project. Sarah Ofori, GBC 24, La Accra.
Yeah. Sister.
have passion for them.
Yes. Oh, he will do it. I think we'll do some presentation for people who don't understand,
in the area of health issues. In the past, we've undertaken contact tracing on TB efforts. We've been fortunate to be shortlisted as the lead NGO. The health system is doing immunization. So we are not going to do clinical cases that are not getting the immunization. As we wait for the slide presentation.
I have been working in the area of health, and I'm very pleased because concerned health, I think for past 3 or 4 years, we have been working in Lada de Kotopon. And I would say that if all the NGOs were like concerned health, I think it will help a lot in strengthening the health system. Very responsible NGOs, easy to work with and understand the health issues. So for Global Alliance for Vaccine Immunization, and then you being selected as the lead NGOs, it is pleasant to us because one of our challenges, especially in the Lada de Kotopon municipality, are immunization coverages. We have the populations, but it seems our people do not come for immunization. We have distributed our community health nurses to all electoral areas. They have opened CWC clinic, child welfare clinic in all electoral areas. They visit them, some once a week, some twice a week, all the points. But people do not come. Why they don't come, we don't know. So maybe concerned health will help us to bring the people to us so we can provide the immunization. Most people in the community feel if the child is fine, there is no need to bring the child for immunization. Some do not understand that the child needs to be immunized on several occasions. We have to boost the immunity of the child. For now, till the child gets 1 year, we have to give about 9 different shots of the vaccine. We give BCG, then at 0.0 at birth, polio zero at birth. Then at 6 weeks, the mother has to come back. Then at 10 weeks, the mother has to come back. At 14 weeks, the mother has to come back. At 6 months, the mother has to come back. At 9 months, the mother has to come back. At 1 year, she has to come back. At 18 months, she has to come back. And she has to continue coming every 3 months till the child is 5 years. So the first month, the mothers come. But as time goes, the child is fine. He doesn't need anything. So we need a support from NGO to encourage the people in the community, to encourage the mothers, to talk to them, to bring them to the immunization service so we can provide the needed immunization for the children. So, in fact, I'm very glad that you are working with us, and I'm very glad that you are working in the area of immunization. So I hope by 2015, we will score 90% plus in our immunization coverage. Thank you very much, and all of you, please, welcome to this small conference room. Though it is not very comfortable, but we are all together. So, and I'm sure we'll have a nice presentation. Thank you.
Within the various communities, and also the community development offices. The design is that we are going to work in 10 electoral areas. And each electoral area, we are supposed to identify a satellite point. And if there is an already satellite point, we will need to work with the system to see what we can do to get it function. We are going to recruit 100 volunteers, and the intention is that each 10 district will have 10 volunteers, against the backdrop that you are going to work with the health system. So as we move along, we will also be grateful to identify the various community health centers or the CHIP zones, so that at least we could be able to engage with them. We have also inaugurated the T-shirts that the volunteers will be using, and as time goes on, Madam and the presiding member, of course, will help us to launch the T-shirt, and we are going to distribute 10 T-shirts with various colors. That is our innovation. All what we are saying is that each community will have a different color. So green in a different community, blue in a different community, and each assembly member will be our contact person by way of evaluation and monitoring. And also the health workers will support the trained volunteers as we move along. So it is in this respect that we are here, and I believe as we still wait for the presentation, I will call for the T-shirts, then it is nicely launched, and then when the presentation comes, I take you through the procedure and how we are going to work. Thank you very much. A round of applause for all of us. So what it means is that you are going to get one of these T-shirts. And then that could be
to choose the color.
The color, exactly. And I believe once we choose the color, we are going to help that community that does that. Thank you very much. So then you don't return it. You don't return it? Yes. You keep it. So then how becomes yours. At the national front, where the coalition of NGOs in health, of which Concerned Health belongs to, has been engaging the Parliamentary Select Committee on Health. In the case of community mobilization, we have skills in volunteer recruitment, and also we have engaged with the health directorate in the area of bed net distribution when it came. We do have interns from abroad, some students who also comes to engage in volunteer services. In the area of climate change, we sit on a technical committee with the Ministry of Environment during the environmental policy. Our concern within the environmental policy was the area of environment and health. Our mission is to send information to the doorstep of our target beneficiary, and our vision is to grow together with the underserved. All what it means is that we have to grow together as a people. We have achieved some programs. We've worked, like I said, with TB. We've gone to communities to educate mothers and children, and also how to reach slum areas on how to prevent TB. We've been able to refer some TB cases which have turned to be positive to the health directorate. We are now going to embark on Gavi project in 2015. And Gavi simply means Global Alliance for Vaccines. This work is saving children's life and protecting people's health by increasing access to immunization. And therefore you have Gavi immunization support, which sends down to civil society organizations and also to communities. This is how the structure goes. Gavi will strengthen community health interventions, strengthen health worker force to address equity, improve storage capacity, empower CSOs, strengthen governance and health information management. The contract that was won by Ghana was close to $18 million, and 54% is given to health system. 29% is going to NGOs. And throughout the country, the coalition of NGOs in health was the beneficiary for the 29%. So what it means is that specific districts that have recorded low coverage and the NGOs working in it will be supported by the coalition of NGOs. It is in this respect that Concerned Health also falls within the ambit of LADMA. This is how the funding disbursement goes. So you have Gavi, who is the funder. We have Ministry of Health, Ghana Health Service, the implementer. Ghana Coalition of NGOs in Health, which is the CSO implementer. And out of that, Concerned Health belongs to, representing LADMA. So you have Concerned Health. Now, Concerned Health is to identify the district health management team. So in this case, it becomes the municipal health management team and the LAC, Municipal Assembly. So then the two of us are going to work together. Now, within it, when you go down, you have Future Watch Foundation and you have Cry Soldier. These are all smaller NGOs within LADMA and LECMA. We believe that they are closer to us and we could engage them, empower them to also become our partners.
Municipal Coordinating Director. I'm